Good evening, everybody. Good morning, everybody. Evening, good afternoon, whatever might be it. So many people are joining from the different part of the world. So would like to start our webinar. This is the last webinar of this year, 2020 last webinar. Since long time, we are conducting webinar, virtual workshop through the link as provided by the Bahula Foundation and Research. And this is the last one today, which two prominent speaker from West Bengal, Dr. Monjira Sur and Dr. Kollan Sur, and they will deliver their lecture in the first session. Both Dr. Sur, the Surs, both are very much renowned in the field of homeopathy. They have introduced a very beautiful technique for the mind technique. And Dr. Kollan Sur is the founder of the School of Homeopathic Mind Technique. And since long time, she has been practicing in homeopathy at Kollani area of the West Bengal, and very good practitioner, good orator in the field of homeopathy, and innovative ideas. And many people may say that it is nothing but extract of a Segal method. So many people say it is the extract of the
Yes,
Kent's
yes.
method, whatever may be it. And he has developed a lot for the people, for the students, how to understand the mental rubrics and how to apply it in practice, by
Yes.
clinical practice. And owing to his contribution, our obviously our students will be benefited from his lecture, from his case studies and others through the mental rubrics and others. I request Dr. Suma Madam to start this program. Dr. Suma
Okay.
Madam? Okay,
Yes,
okay,
sir. Yes, yes.
okay.
Uh, Once again, good evening to all. Once again, we are meeting today in one of the happy and the pleasant evening. As usual, today also we have arranged one of the good workshop. The three speakers are there. That the all the three speakers are very eminent speakers are there. And the first speaker is Dr. Monjira Sood. She is the president of the School of Homeopathic Mind Technique, and she will speak on surgical and medical cases. So I welcome to Dr. Manjira Sood ma'am on behalf of Antar Bharati Homeopathic Medical College. And in advance, I will give you the happy, in advance, Happy New Year, sir. And
Well,
I declare the today's session. You can start. Thank you, sir.
thank you, madam. Thank you, madam. Thank you, madam. Okay, viewers, now the 100 crossed, 102. Now it is going on
Yes, yes,
102.
very nice, sir. Very
Okay,
nice.
102. So many people have joined from
Mm.
Bangladesh, West Bengal, and different part of the country, and also
Yes.
abroad.
Mm.
Dr. Sur, Dr. Kollan Sur, and Dr. Monjira Sur, please start your program.
Good afternoon, everybody. I'd like to pay gratitude to the founder director, Dr. M.G. Jite, convener, Dr. V.C. Gore, principal, Dr. Meena Sambha, superintendent of HMCH, Dr. Prasant Varvat, CEO of Bahola, Mr. Kartik Raghava Murthy, and Professor Dr. Akhilesh Khan, Professor Emeritus and Mentor of Antar Bharati Homeopathic Medical College and Hospital, Dhaba, Nagpur, and Bahula Foundation for Homeopathic Research and Foundation. I would like to pay my many thanks to Dr. Akhilesh Khan for giving me and for inviting me the opportunity from my experience. It's a great honor for me to attend this virtual workshop. I'd like to pay my respect to my co-speakers and all respected and esteemed doctors who have joined this workshop. Now we are going to establish or going to show you some cases within our time depends on the mental state only. What is a mental state? That is On the mind section of the repertory, we depend on the mind section only. And if you judge the mental symptoms and collect the mental symptoms minutely, you can assess his or her mental state. And depend on the mental state, you can prescribe the good medicine, and the patients must be cured by that. So, what are the points we want to know? As we are the newer in this today's workshop to you, that's why I want to know all of you that the few points briefly how we take the case depends on the mental symptoms or judge the mental state. Treat the patient with the help of mental state only. That is a rubrics taken from mind section of the repertory. We use mainly the synthesis in this respect. Synthesis repertory. There are three vital points we have to judge. That is present, predominating, and persisting. What is the present? The patient is telling in front of you. You means your doctor in front of you. This is a present. And predominating, what the patient is telling in front of you. Out of that, what is the predominating symptoms? You must assess. And persisting, what is persisting? Persisting is the what symptoms are going on. That is, he may carry the symptoms, and in front of you, whenever he is telling in front of you, that symptoms is, say, he's telling about the symptoms. There are so many words, but within this time, I want to express this by some few points and expressing each of the points with the examples of the patient. My view is that whenever you read a rubrics, you must read the every word of that rubrics with a literal meaning, that is a dictionary meaning. And after that, you must imply that word to your patient. That is suppose patient is telling in front of you that is he has some fever, but how he is telling and what in what aspect, like that you must assess that one. So the present, you must take the present mental state, present symptoms, and what is the predominating of that case. And I want to tell the cases is that after finishing all my points and the persisting, the next and very most important one is we must ask the patients about these points: when, how, what, and why. When the patients will come to your chamber, and how he has come, and what is his symptoms, what he is telling about his problem, and why he has come. Either he has come to a chamber for himself, or his family members forced to send him to a chamber, or his official persons ask him that why he is so many days absent for his job. After hearing this, he has come to a chamber. So there are different rubrics there. Whenever we teach, I can talk about that rubrics, I must tell you. This is the points that are before 3 points and then 4 points. Among these points, judge, and then you judge the mental state of that patient. There are another points. After selecting the rubrics and giving the medicines to the patient, some complain that there is a discharge will start. But I here write down that if you have the correct prescription, the discharge is abnormal discharge. There is discharge that is like the urethra and anus, that is urine and evacuations. This is a common discharge, normal. This is not the fact. Our point is that abnormal, I have write down here, that is abnormal discharge comes out from any 5 natural outlets, that is from nose, mouth, urethra, anus, skin, may come. Or sometimes I said may because sometimes patients are aware about this. Patients have noticed this. Sometimes the minimum symptoms is there. Patients are not noticed about his or her problems. So suppose nose. After giving medicines for the migraine, patients complain that I have severe nasal discharge, severe watering from my nose. I can't maintain my job. I am a receptionist of an office, so it is impossible to me to continue my job as a severe watery discharge from my nose, like that. But you think that your prescriptions is, if you have the confidence about your prescriptions and the patient feels better, patient told you that I'm feeling better about my migraine complaint, that time you think that your prescription is correct one, and you may give the placebo like that, and you know the placebo is a good prescription. And next one is the mouth. After giving some complaint of the patient is complaining that there's a vomiting started after taking the medicine, but I have no vomiting complaint before that, before taking the medicine. So you think that my medicine, my prescription is a correct one, and you must wait and watch and give him the placebo. Urethra. Urethra is a normal, passing of the urine is a normal one. But if the patient complaining that after taking my medicines for the gouts, joint pains, the paining of my knees, there is several times I want to go to the toilet. Even in the night also. I can't sleep. But my knee problem is better than previous. And I can't do my job, household work before taking the medicines properly. And now I can. I am better than previous. But I'm passing so many times to go to the toilet. And it is very, I can't do this. It is a very bothering to me. But you know that it is a good sign. And anus, patient is complaining that after taking the medicine, a patient is passing stool several times and consistency is bad or worse than the previous. And what about the skin? After giving the medicine for the respiratory complaint, patients complaining that I have a skin eruptions, which was not, but now I have. Or patient may complain that after taking the medicine, there's a high rise of temperature. I have no temperature. I am not feeling sick off and on, like fever and something like that. But after taking respiratory complaint medicines for this, there is a high rise of temperature. But you know, you have the confidence, you have the confidence about your prescription, you must wait. And tell the patients about that this is a natural phenomena and you may take this one, that is you may take this placebos. But one thing is that how many days you can wait. This is my next slide is this abnormal discharge appear on the odd number of days, that is on the first day, third day, and fifth day. It persists fixed period of time, that is fixed number of days, hours, and minutes. Next one is goes to the peak and then gradually decrease. And one of the most important, that in spite of this discharges going on, patient tells you that if he feels better as discharge gradually comes and goes off. I missed here, that is gradually comes and goes off. One main thing is that patient feels better. That is, a patient is mentally better than previous. This is the criteria I have to consider when we going to prescribe medicines for patient. Now, I'm telling a short case, that is, now we are facing the COVID-19. On this pandemic situation, most of the persons, either medical or non-medical persons, know that what are the symptoms about the COVID-19. So, on the basis of that, I want to tell you on short case. During this pandemic, once morning, one of my patient, 25 years male. I'm not observing you the video cases because it takes too much time. So I'm telling the cases shortly. He called me once morning that, ma'am, I am very sick. I said, why? What happened? He said that for the 4 days, I am suffering from fever. And I took some medicines. Beside my house, there is a shop is there. And I took some antipyretic medicines like that. After taking the medicines, the temperature comes down for the 6 to 7 hours, and then it goes high. I think, and the shopkeeper also told me that at least 3 days you must tolerate, and after that it goes off. But from the yesterday morning, I feel very sick. I have the severe headache with a throat ache. And you know, I have a nasal polyp from my childhood. And from yesterday morning also, I can't get the proper smell of my food. From that point, from the yesterday morning, I confined myself in a room, and my family members served my food within the room. And with that room, there is a attached washroom is there. So I use that one. But after that, after taking some antipyretic also, there is no solution was there. I think that I am attacked by the COVID-19, and I think that I must call to if the problem will not solve by you, then I'll call to the health personnel nearest to my house, and they will take me, or I'll call to the police. They will take me to the proper places. I said, why you are telling like this? He said, no, I know the symptoms of the COVID-19. One of my friend was affected by this and he had the symptoms. And my symptoms is similar or same to that. I said, these symptoms may be due to the simple viral infections also. And you have the nasal polyp from your childhood. And from that, after getting the cold, catch and cold, nasal polyp will increase and you may not take your smell from the nose. So what happened? Think positive, and this may not be the COVID-19. But in spite of this, in spite of my conversations, he said that no, man, I am definitely suffered with the COVID-19. And if you have any solutions, please give me the medicine. And if may not, I must call to the health personnel and police and like that. This is the case. And after hearing all the symptoms and assessing the mental state of the patients, I select the rubrics, that is fear, superstitious. You must not select the rubrics line by line, word by word, what the patients will tell. You must assess the mental aspect of the patients, mental state of the patients, what he wants to tell. If you take the rubrics word by word, it is not the good one, good prescriptions. But on this method, we must select the rubrics depends upon the mental state only. And for that reasons, it may be single rubrics. Whenever the single rubrics is selected for the whole of the cases after the judgment. So, on this case, I select this fear, superstitious. Why fear and why superstitious, I want to tell you. What is the meaning of fear? Fear is an unpleasant thought caused by something dangerous, painful, or bad that is happening or might happen. That is unpleasant thought. What is unpleasant? Patient was pleasant about his patient was satisfied about his problem because he used to take the medicines for antipyretic from his nearest shop. But whenever he started his throat problem and he cannot, that is anosmia start, that time he thought that is he was suffered by COVID-19. That time his mind is the unpleasant thought. Why? I have written here, caused by something dangerous. Caused by something dangerous, and that is a painful or a bad that is happening or might happen. That is happening. He is suffering from this. And if he has the COVID-19, that's why he confined himself to his room. That is might happen. Can I share my slide with all? Sir, Dr. Rock.
Yes.
Okay, thank you. And next number is mixed feeling of dread and reverence. He is very much feared about his problem. And why this is a reverence? Where is the reverence? He is reverent about his family and about the disease, because he knows that if there is a family members, his father and mother is there, and he knows that aged persons are affected much more, and if they are affected, they will affect, it will be the dangerous, more dangerous for them. So he must reverent about his disease. So that's why he want to confine himself within a room. And that's why he wants to go to the outside for curing himself. So he must reverent about his family, and he must be reverent about the disease also. Next one is superstitious. What's the meaning of superstitious? That is ignorance about scientific knowledge. And next one is excessively credulous believing. And next one is reverence for the supernatural. Ignorance about scientific knowledge. Where is the ignorance here? Patient is non-medical person. So he must not be aware about the other diseases like the symptoms of the COVID-19. So whenever the symptoms will appear, he thinks that is this one due to the COVID-19.
Online meeting.
And excessively credulous believing what he is thinking. He thinks that if this is the correct one, and he is credulously believe his thoughts. There is a no judgment, nothing is there. And reverence for the supernatural. He is reverent. It is a disease, infectious disease, and he is reverent about this disease. That's why he wants to cure himself, and he wants to save his family members, especially the aged one. That's why he is reverent about his family and about the curing of his disease. So superstitious is a correct one on this aspect. And fear superstitious, you know, that is on single synthesis. I used to synthesis 8 point. So there is a superstitious fear superstitious. Only one drug is I've shown you, that is Rastrux 30, 3 doses. Rastrux 33 doses. So after taking the Rastrux, fever was there. It takes little time, 6 hours, 6 to 8 hours, but the patient is mentally well, and he is well about, because he told me that after 3 hours he called me and told me that, ma'am, I am feeling well. I think it may not be the COVID-19. So you please give me more medicines and I'll take your medicine, and that's why, and that way I must be cured. So see that case, he is mentally okay. Mentally he is free about that belief. That's why I took this case, only the fear superstitious, only single rubrics and single drug, and that cured the patient. Next one is a case of osteomyelitis. You know that osteomyelitis is an infective disease, infections in a bone. Infection can spread through bloodstream. Causes of osteomyelitis is a staphylococcus bacteria, which enters through the bloodstream, commonly found in the skin or in the nose, on even in healthy individual. But whenever it affects the person, the common site of osteomyelitis is the long bones, pelvis, clavicle, having the symptoms of redness, pain, swelling. It needs emergency management. Prognosis is very bad if it is untreated, goes to sepsis. Some hospitalized patients may suffer from osteomyelitis due to infection entered through the catheter also, through the IV channels, those who have stayed long times in the hospital, or through the surgical wounds. And if it is untreated, the complications of the osteomyelitis is, that is a fracture of the affected bone. There are two types of osteomyelitis, that is acute and chronic one. Acute takes 2 weeks to bone infections, and chronic takes 6 or more weeks for take the infections. It causes bone destruction, bony destructions, and formation of the sequestra. Formation of the sequestra. So this is a brief aspect. Whenever any pathological and medicinal case I want to describe, I want to tell some pathological aspect or medicinal aspect of that disease, and then I want to tell the rubrics about that. I want to show you the still pic of that patients who had suffered by osteomyelitis of his right foreleg. You see that after suddenly seeing that it's like a punched out ulcer. That some discharges coming out, and deep ulcer is there. This is a shin bone. So you know that there is a less musculature on the bony aspect. And if it takes untreated, it may fracture that part. After taking the medicine, granulation tissue comes out. After some days, some months, or some days, after some time, in this one. So I want to tell about the case. A 45 years old woman came to my chamber having the problem that pain in his leg, wrapping the bandage in his foreleg, in her foreleg. She said that few days ago she had suffered a pain in her leg with some redness and much swelling, a little bit swelling was there. She thinks that some blunt injury was there. So she put some ointments or some cold compressions like that. But after that, she thinks that is some insect bite was there. But after a few days, she noticed that something comes out from that point. Then she, after giving some antiseptic lotions, she wrapped properly dressing, and she wrapped that part. 2 to 3 days she lived there. But the day before yesterday, which day she came to my chamber, after uncovered that wrapping, she noticed that there is a small hole and some discharge is coming out. This is the case. And then she came to my chamber. After coming, she told me that, like this way, ma'am, please see my part, why it is occur, and when and how. There was a simple red spot was there, and I put some medicines and some cold compress, etc., etc. But today morning, when I removed my bandage and gauze like that, I noticed that this some small hole is there and some discharge is there. Yesterday and today also, I noticed. But why it is? How it will occur? This she is telling like a charging way. And she also told me that previously you gave me on other complaint, so good medicines was there. That's why I want to come to you for this complaint to treat for the treatment of this problem. But I can't expect this. This nothing was there, and why it occurred? See, as if I will give a big hit to her leg, and that's why she was suffering from this. And after that, she told me that. Then she told me, give me some medicines, because whenever I had a bad migraine, you prescribed me the good medicines, and after taking the medicines within 1 hour, it was abolished. And the next time, whenever I had the severe abdominal pain at that night, and you also prescribed the good one, and I also relieved. But I think this is a simple one. This was a simple one. There is a simple redness, simple swelling, and slight pain was there. But yesterday and today, after removing my gauze, I am very much astonished that what happened. So give me some medicines before that. I want to show you you see that after giving the medicines, the granulation tissue comes out from that wound. I took the rubric that is shrieking help for and delusion help calling for. 2 rubrics I took. What's the meaning of shriek? It is a high-pitched noise. What I have write down here, that is high-pitched noise, not the sound. What is a noise? Noise is a sound that is a disagreeable auditory experience. That is the disagreeable auditory experience. You have the disagreeable experience. You can't expect the patients, that is, she or he will charge you why it is occurred, how it is occurred, charge you. He or she may ask you how it occurred, but they can't charge you. They may, but this is not the agreeable one. So that is I took the rubric that is shriek, shrieking help for. Shrieking help for. Next one is, I want to describe the help, but next rubrics I wish to go. That is a delusion help calling for. Next one. So shrieking help for, there is a help is there. So we must know that what is the meaning of the help. We know every help is what is the meaning of help. But in the mental aspect, you must know much more than the previous one. That is, help means give assistance. That is, she was trying by applying some ointment, by applying the cold compress, and like that, or dressing that wound area, but it was not relieved. That's why she want some assistance. Who is the assistant? She thinks I will be the assistant. Next is change for the better. Now she is, at that time she was our positions, but she want to change she wants to change her positions for the better aspect. And the next one is contribute to the furtherance of. That is next one. She wants to contribute it and make it easier. That is, make it the previous one, make it the healthier one. That's why she wants to help me. But previously, firstly, he shrieked, helped me with a shrieking voice. So for that reasons, I took the shrieking help for. And the next one is, after that, she told me that you have cured my other cases, other complaint previously. So give me some medicines for this cause. So this time she wants to help from you. So that's why I took that is delusion help calling for. And the next one is, what is the call? I used to tell you that I wish to teach that rubrics in every word, and then I must be explain that word which is applicable on that cases aspect. What is a call? Call is assign a specific name to. She's calling me. She wants to calling me. She came to me for relieving purpose or relieving her complaint. Try to get into communication. But she's calling me for communication. In mental aspect, there are so many rubrics that they are similar but not the same. Communicate, talk, speech, all are rubrics. So communicate. What is a communicate? Transmit thoughts or feelings, interchange information or ideas. That we are communicate with each other. Now we are participating in a virtual workshop. So we are communicating with each other. And last one is indicate our decisions in regard to. Indicate decisions. She wants to take a decisions whether she came to me for get rid of her problem and asked to come. That's why I took the rubric that is delusion help calling for. I gave platinum 33 doses. And you've seen that after taking the medicines, after some times, the patient is cured. And as the osteomyelitis is an acute emergency case, so in spite of this, after giving the platinum, only the 3 doses, it was cured. For selecting the 2 rubrics. And the next one is okay, thank you. This is the last, I think, because okay. Dr. Shuri is waiting. So there is one small case, short case is there. That is fear extravagance. you know, on the mental aspect, fear extravagance has got the various meaning. On the perspective of a patient's view and on the perspective of a case, I want to express one 55 years old woman came to my chamber having the problem of both knee joint pain. She told me that I have pain in my joints. I asked her, that is, knee joint pain is not the 1 or 2 days or 1 or 2 hours or 3 days or 5 days like that. To whether she was affected by that both joints. She told me that it was paining for several months, and she is a housewife and used to do the household work properly. She said that I am very much tidy. Mind that point. You must judge the mental state, not the symptoms. Whenever she told that I am tidy, you write down the tidy and responsibility and like this. No, fastidious, no. She told me that I am tidy, but for the few months, I think that I can't do my job properly. I asked her, that is, so, okay, no problems. You may help with your maids or other family members. She told me that no, their work is not so good. They are very unclean way they work. I don't like them. I used to do that. Then I think that why she had come to me. I asked him also. She said that for the last 7 days, the pain is more. And I said that for that pain, what treatment was going on? She said that I took some painkiller, and after taking, I was okay for the 3 to 5 days. And then again, I used to take that. I asked her, that is okay, no problem, you may take. She said, no, ma'am. For the last 7 days, previously I took the one painkiller and it will persist the effect for the 3 to 5 days. But last 7 days, I took twice daily the painkiller, anti-analgesic, but it was not working as previous. And from the yesterday, pain was severe and no anti-analgesic high power was acted. I can't stay properly. I can't use my personal work. I can't use the washroom properly. I must help with the other family members. You see now, that is whenever I come to your chamber, I can't walk properly. The pain is so much that it crosses my threshold level. I can't tolerate this pain. There's so much paining at present. And today is your chamber date. And tomorrow you will not hear. And if the pain will be much more, how can I use the washroom, or how can I maintain my personal work? So I took the rubrics here, that fear extravagance. I have also told that about the fear, and now I want to tell that what is extravagant and why I took this rubrics in this case. Fear extravagance. What is extravagance? The meaning of extravagance is the quality of exceeding the appropriate limits of decorum and exceeding what is reasonable or appropriate. That is, she told me that I cross my threshold level. I can't tolerate the pain. Previously it was, but now from the yesterday it is intolerable to me. And the next is why it is fear. She is very thinking about that tomorrow I will not be there. So that pain is so much. If she will not face me or not getting me tomorrow, the pain will much more. And that time it was many problem. There will be many others problem, much more problem about to maintain herself. That is her personal work also. That's why after thinking that she is very much fear. So that's why I took the rubrics fear extravagance. So after hearing the whole case, what is the mental theme here? What is the mental theme here? That is the whole case, patient is very much fear about her problem, and that is extravagantly. So I took the single rubrics, that is fear extravagance. And the opium, I gave her the opium, prescribed her the opium, 33 doses. And after taking the opium, it comes down. And after that, there is a placebo was there. And beside that, I advise that woman, that patients, that please reduce your weight, as these are the most weight-bearing joints. And whenever the fatty patients is there, it will be the most problematic to the patients. So after that, the pill, taking the pill, and she is much more better, and gradually it is lessening her pain. So I took so much time, and I am very glad that all the respected and esteemed delegates and organizers and in front of me, that is Dr. Professor Akhilesh Khan is here. Thank you very much, all of you, and thanks to all, and stay safe and stay healthy for this COVID situation, and thanks for the coming Happy New Year also. Thank you once again.
Thank you. Please stay with us because